Welcome to Diplomatic Passport, where we give you daily weekday updates on the state of the world, region, and of course Zimbabwe with regards to the COVID-19 pandemic, the statistics, progress, and impediments in the response to arguably the biggest health crisis facing mankind in our time. I'm Robert Mkadiwa. We're back from what was an eye-opening trip to the Eastern Highlands in Zimbabwe, as we worked hard to capture the mood in the country and give COVID-19 perspectives from across the nation. We've been to Mutoko, Bulawayo, Mutare, and Rua, and will continue to give you the story of the pandemic from a varied and a number of voices as possible. Today, Diplomatic Passport, alongside the African Union Commission, joins the world to commemorate International Nurses Day in support of the invaluable contribution of nurses to the prosperity of healthcare delivery systems across the globe. It is International Nurses Day. And the Commission's Amira El Fadil Mohammed, the Commissioner for Social Affairs in the African Union Commission, issued a statement paying tribute to our heroes. At the onset, she pays respect and tribute to all the nursing staff who have lost their lives during the COVID-19 pandemic. Their care, value, and dedication will be honored throughout generations. In addition, the World Health Assembly has designated 2020 the International Year of the Nurse and the Midwife. So in addition to the commemoration, they are also joining the international community to advocate for increased investments in the nursing and midwifery workforce. Now, nursing has been a profession with a powerful sense of public service for over 150 years. Over the years, nurses have served the community as providers and collaborators within the primary healthcare framework. They have also strongly taken up an advocacy role by reaching out to communities for health promotion and calling on decision makers to formulate better health policies. Today, they remain the most vital workforces in healthcare, playing a crucial role in disease prevention, treatment and care. Now, the Commission called upon all AU members to ensure that all nurses and midwives operate in an environment where they are safe from harm, respected by medical colleagues and community members, have access to a functioning healthcare service, and where their work is integrated with other healthcare professionals. Now, if you're a nurse and you're tuned in today and you're watching us on Diplomatic Passport, we take our hats off to you for your amazing work. Our human race is blessed to have you as a part of our human fabric. On to Zimbabwe now, where COVID lockdown and quarantine has gotten to people and they're not amused. If it wasn't dangerous, then indeed it would be funny. And it would be akin, perhaps, to being the COVID-19 marathon, except it endangers the lives of other people. It is reported that 8 people in the southern border town of Beitbridge who had been in enforced quarantine escaped from a holding center in the southern African country and have not been seen ever since. Now, the reports, of course, as I said, have not been substantiated or confirmed yet, and we are making frantic efforts to make sure we get that story. However, still in Beitbridge, we hear that the work that's being done in the quarantine area and their efforts at testing and ensuring safety and quality assurance.
The center. So there are those that had a second test done, the second rapid test, and they were found to be negative. And those are the people that we are discharging, so that at least they will go and complete their quarantine in their respective homes. So we're expecting roughly around 140.
Of course, that's what's being done in Beitbridge. And with regard to that story, I said we're going to follow it up and see what the facts are behind it. Certainly, we understand that isolation and quarantine are tedious on the mind, but in the interest of public safety, going through that tedious ritual is good not only for the person in quarantine, but for the community at large. Now, still looking to the south of Zimbabwe, and we skip into the neighboring country of South Africa. Now, we're going there for a very, very scary story. We've been talking of exploring e-learning for our children in the age of physical distancing. But while the children cannot be supervised all the time, the sexual predators are also lurking in the dark web, ready to snap up our children. Now, apparently, now more than ever, children are more at risk of online sexual exploitation by cyber predators. This is obviously because, according to UNICEF, more than 1.5 billion children around the world have been affected by the lockdown, and a large majority of them have had to move to online learning or unsupervised screen time to keep up with schoolwork or connect with friends. Now, from Birmingham, United Kingdom, we're joined by Carol Nyakujuga to speak to the complexities of e-learning when predators lurk. Carol, welcome to the program. Now, first, with schools closed and kids depending on online learning because of lockdown, do you think now more than ever children are really at a risk of online sexual exploitation?
Hey Rob, thanks for having me on the program. Yes, definitely. I mean, I'm both a mother and a businesswoman, and having worked in mental health for more than 20 years, that's definitely something that is high on the agenda. And having worked in children's services here in the United Kingdom, children's safety and safeguarding children is very, very high on the agenda. And now, of course, there's been a lot of issues coming out, especially in South Africa, around, young people being asked to expose themselves with nudes and exposing their private parts to boyfriends or to colleagues, which of course it puts them at risk of being sexually exploited. So most definitely.
Well, that's a very, very scary prospect, especially at a time like this. Now, in the cases you personally have dealt with, how do these child online sex predators lure kids? What are some of the modus operandi, if you will?
Yes, and they're not always very direct. I mean, it starts, obviously, it's a grooming process. We have found in the United Kingdom that it is grooming, isn't it? So it's not clear and direct. So if it was clear, a lot of people, their direct response would just be no. But what tends to happen is that people get into relationships. There's a trust element. People get to trust each other. In relation with each other, they begin to share images of their private parts as a way of expressing emotion. And of course, with this is adults and it's consensual, then it's a different matter altogether. But where it's young people and children, then of course the young people then are more prone to things like blackmail, especially Kumba, where, in Africa or in Zimbabwe, where if a young person then, if their parents know that they've exposed themselves, it's a big issue, isn't it? So it's for us parents to be aware of, really.
Absolutely scary there, because that's definitely a pedophile's party we are talking about. But what are the effects of this practice on the kids who fall victim, for example?
There's definitely bullying involved. That is a definite thing that we cannot run away from. There's blackmail, there's emotional blackmail, there's psychological factors as well that then affect these young people. Issues like shame, and of course the fact that somebody else can continue to manipulate you even years on end after that. And then of course what also can tend to happen is that other young people then adopt other practices like drugs, alcohol, and other socially irresponsible practices in response to being in a position where they're emotionally vulnerable and they're being blackmailed as well.
Very interesting, very interesting. Now, perhaps finally, how can parents safeguard their kids from falling prey to these predators, though?
As a parent, and of course, as I said, as a mental health practitioner and a businesswoman, it's important that we are keeping watch of our children, particularly these moments that our children are at home. It's making sure that we are talking to them as much as we can and watching behavior and attitudes change. So if you find that your child who normally was more outgoing and more socially adapted is now more drawn or more angry or is having more mood swings, then you might want to take that opportunity to begin to have conversations to find out what's going on in their lives. Taking a non-judgmental attitude is always really useful with your own child. I mean, the journey of parenting a child goes long distances. And so it's really important at those times that the child can trust you more than they can trust the external person who's abusing them.
Carol, we'll have to leave it there. Thank you so much for joining us, and we're always indebted to you for your expertise. Now, that was Carol joining us on this important issue that is bound to worry a lot of parents. She was joining us from Birmingham, Alabama. Of course, a lot of parents whose children are moving to e-learning online will be very worried about that. Now they're vile, and we really are seeing that there's a big problem with them. So now they're vile, and they have been bleeding our economy. We had gone for quite a bit without them, and we're happy without them. They are obviously connected, and now they're back and they're well resourced.
Guys, let's just do this. Shandan, Tavuriro, guys, Tavuriro. Ondi nokundi beina, hand.
Born no undi beina. Changa basa de Jesus yuan.
Let's start afresh, guys. This is good, guys.
Young select this like about again.
Now, many of you will have seen that video. He is brazen in his approach. He exudes a lot of confidence in that video. And now, the Reserve Bank of Zimbabwe claims it is going after that gentleman in the video. And I use the word gentleman very, very loosely. Meanwhile, today, creatures of his species that are bleeding the economy and harming ordinary poor folk like you and me were alive on the streets. And thankfully, at least for today, they got arrested. Now, whether that shall inspire a change is absolutely in doubt, but that at least something was done about them today is a bit of progress. Now, until tomorrow, keep giving me your feedback on these and other COVID-related issues as we strive to keep you informed. So from me, Robert Nkondiwa, have a good evening, stay at home and stay safe.